And lastly, we have the opportunity for a select group of patients to participate in a research study conducted by Dr. Mozaffar and his team at UC Irvine. So he is going to come up and explain a little bit about that. And oh, here we go. All right, so here's the slide with some of the housekeeping items. And then Dr. Mozaffar, if you'd like to come up and speak about the study, that would be excellent, and the inclusion criteria especially.
Thank you, Brandon. And I will be giving a slightly longer version of the talk later on today, but before we started collecting blood, I thought this would be a good idea to introduce at least the study. So this is what we are proposing, and nothing is finalized yet. We're still in the discussion phase, so there is a lot of room to change, and would love participation from and get patient inputs. And I'll explain all of that when I speak later at around 1:30 or so. But what we are hoping to do is to have a federally funded grant to do a natural history study. Natural history study is a longitudinal observational study where we look at disease behavior, disease progression, but also look at biomarkers. And biomarkers are essentially surrogate markers that we can use to follow the disease in addition to the clinical parameters as well. Right. So there are a number of things we can look at. To put any grant in, you have to have preliminary data. So some of the blood collection that we are doing today is to look at some novel markers that have not been looked at in VCP, including phospho-TDP-43 in blood. We're looking at lipidomics and metabolomics. So what we're asking for you, if you can, is to spend some time, if you can, give blood. The patients the folks we are looking for are patients who are already diagnosed. We are not going to collect blood from individuals who may be at risk because they are family members of somebody with the disease. Spouses are welcome because that will serve as a control, right? And any caregivers that are not directly related to the patients are also welcome because they are not likely to have the genetic mutation on that. So we want to have the diseased patients who have already manifested the disease with the genetic mutation, and patients who are not related and who are not at risk for the disease, because we want to look at both sides of the story on that. It's going to be a nationwide study. It's going to be a multi-center study, and the way we are planning it is very similar to what we did with our inclusion body myositis trial, which Dr. Weil is also part of. We would like to have strategic locations throughout the U.S. So if the patients need to travel, they've traveled to the nearest site rather than coming to one center or two centers around the world. So we're going to have major portion. The Nationwide Children's Group is already doing a similar study, but doing it remotely. But certain things that we want to do are not amenable to remote monitoring, and they will be part of it. Lindsay Alfano is going to be one of the PIs for the grant, and we will try to validate new outcome measures that can be used in future clinical trials. So I'll talk about it in more detail. I just wanted to introduce the study so you don't get caught by surprise when somebody asks you to donate blood. Okay? All right. Thank you, Bren.
Yeah, absolutely. Yeah, so just to reiterate, the two groups that are able to participate in this study are people with a family history of the disease who have also had their genetic testing. Positive and negative testing results are okay. And then people who do not have any family history of VCP, completely unrelated.
The only qualification is family, a positive test, but also manifesting.
Exactly, yeah.
Who haven't manifested, we are not.
That's right. That one qualification right there. So we will be having, this testing is available at our lunch hour. We will have signups at the first break. So our first break is coming up shortly, just after 10 o'clock. So Anne-Marie will be just outside this door, and you can sign up for a 30-minute time slot during lunch to go ahead and give your blood and participate in this study. Consenting is super quick, so she is getting super fast at that. And then I think that is, okay, so Yes. So if you are not able to participate in this study, you can participate in all FTD. So if you are a person with a family history of the disease and you want to participate in research, all FTD is a study, nationwide study focusing on frontotemporal dementia, which is one of the phenotypes of VCP disease, and it allows for family members, like I mentioned, to participate. Dr. Ghoshal is an investigator. She is here with us today, and we have her brochures where you can learn a little bit more. Feel free to ask her any questions you have. And of course, if you have questions about the blood collection study, feel free to ask Dr. Mozaffar as well as Anne Marie. So.